So what I could also do is get him in that position where I start to feel motion at that segment, so knowing that I'm opening there, and then just change my force hand and just, instead of doing this with the upper inferior process of the facet, I can use the superior process of the inferior facet and just pull toward me, right? So I'm still getting the same thing. And your line of force might change. I think it's on the picture. So if you're in the lower segments, your line of force is going to be this way, versus if I get a little bit higher, like near that L1, L2, and L2, L3, it's going to be like this. Tissue flow for the multifidus, and then we'll practice those. All right, so find the multifidus. Now, you're going to find that turgor point, right? And then I think that's when you then determine, okay, am I going to use my fingertips? Is it like a pretty small area? Or can I get onto, but when you can use that, try to use that. It's just easier on your fingers. Okay, so my kneading, all the same properties that we've talked about. Moldy hands. You want to make sure you're providing a little bit of compression and then letting off. Not pressing too hard so that they're not tensing against you. Lengthening, right? So I'm going to provide pressure and lengthen the muscle. So which way would that be for him? Rotating left, right? So I'm rotating him left. Right. So I'm still providing pressure on that point and then letting off as I turn him and then passively bringing him back. So just relax and let me move you. If anything hurts, always let me know. Third part is shortening. So you're providing pressure, and so left multifidus is a right rotator, right? So I'm going to provide pressure and say, when you feel the pressure, I want you to turn toward me, and I'll move out of the way a little bit. So ready? Pressure, turn, and then relax, and then I'll bring him back. Pressure, turn, good, and then I'll bring him back. Okay, once we shorten it,
a minute and a half.
I'm going to hold for 90 seconds. A minute and a half, and I'm just gonna keep holding the pressure for that 90 seconds. No, exactly. I'm holding my place. Okay, but can you see? So this, I'm just showing you how you would use the table. I'd probably have like a tech or someone help me. So I would find the spot. I would then have them lift, or if I could do this at the same time. I was just nervous about moving the legs in this table. Yep, and then I'm holding this. And then get someone to help you lower this back down. Okay, and then you reassess. Just some little like soft tissue things that I do is I'll just provide a little bit of pressure more with my hands, and then I'll just kind of spread the origin and insertion just to provide a little bit of, it's not really like a stretch, but just lengthening. So it's just like a flow I do with my forearms pushing apart. Okay. All right, so yes, that's one thing you could do for QL or the hip hikes. Okay, thank you. What are things we want to think about, even with our PAs? What about our line of force? Vertical. So I'm just right over spinous process, and I'm just doing oscillations. So I wouldn't really do a sustained hold in this position. Yep, so I was just, pisiform was right over the spinous process, or I can go over to the transverse process, and so pisiform is more on the transverse process, and do the same thing. Your technique, you could use more your fingertips if you felt that was a little bit more specific. So I have my fingertips on the transverse processes, and then I'm providing my force with my left arm. So it's kind of like the dummy thumb like we've used before. So very similar to our assessment. You're still going to flex up the knees. So say I thought that there was a restriction, L4, L5. So I'm trying to stabilize L4 with my cranial hand. And then I'm going to use my legs to flex him up to that point to where I feel motion. There. Okay, so say I thought that was restricted. Now I'm going to hook my caudal hand on that L5 spinous process, and as I'm pulling his legs, I'm going to try and kind of pull or drag that spinous process inferiorly. Okay. still have his knees on my, my left hip. And then I would just hold it there. So obviously these spinous processes, it's hard to like grip onto them. So it is a little bit tricky, but so just do your best. For mobilizing, ideally we want to block the segment above and then extend from the caudal segment. Does that make sense? So we're trying to promote extension here. Similar to when you're doing a mobility assessment and you can use one leg or two legs. I tend to have to go for the one leg. Go ahead and just relax. Thank you. Okay. So you start S1, L5. That's that process right in between, and then you extend till you feel a little bit of movement. Oh, okay. So say I get to like L4, L5, and I feel like, oh, that doesn't move very well. What I then want to do is I'm just using a grip like this, like a pincer, I guess, on the spinous process of L4. I'm going to block L4 and extend. I'm trying to extend L5 via his leg over L4. Okay? The rotation looks just like what we did with our oscillations before, except you can turn it into a mobilization as well. So this will just be good practice. You remember we're going to start more cranially this time, because as I rotate his upper body, I should feel the spinous processes move down toward the table, right? So my hand is laterally but closer to the table, my palpation finger. So I can assess as I go down, feel movement at each segment, and then when I get to a segment I think, oh, I don't feel that one rotate, then I can stabilize. With this one, remember we talked about this one, it's a little bit easier to mobilize via your hand on the hip versus rotating him this way, but you could do either one. You just want to stabilize the opposite. So say we're going to do, I'm going to mobilize inferiorly. I'm going to lock my forearm into his side so that his upper body, his trunk doesn't move, because I've already rotated it down to the segment that I think is hypomobile. And then from here, let's say if I'm in the like L1 through L3 region, then I'm just going to rotate his lower body toward me. Okay? So because we're trying to be very specific to the segment, it's not a lot of motion. So ideally I've rotated down to, and I say, okay, this isn't moving. And now with my right arm, I'm then just pulling this segment this way, the bottom segment, the inferior segment toward me, okay, to promote rotation. And then you can also make that an oscillation, right? Down to L4, L5, and L5S1, your line of force changes so that you're actually pulling a little bit more inferior and lateral, okay? Whereas it was more strict lateral with the upper segments, L1 through L3. So mobilization, I would just hold that for 30 seconds. Oscillation might be more like this. So I'm short, so this is what I have to do sometimes, and I'm fine with that. If you're not, you can use your stomach. The trick is you want to make sure his lumbar spine stays in some flexion. So when I do the distraction, I wouldn't want to be pulling and pulling him down like this where he's going to extend his low back. Just like hold with my hands like this. All I'm doing is leaning backwards. So I kind of have a split stance. I'm just leaning backwards. Sometimes the pressure from the belt can be a little uncomfortable on their hips. You could always put a towel there if you needed to. Does that feel okay? Yeah. They stay flexed, so that make sure, it's going to be hard in here because the tables are so high. If the table's lower, then their legs can be up higher to keep their spine flexed. I'm just going to go on either side, straighten your knees, and then the same thing, I just lean back. Up to 70. You're going to lie prone over the biofeedback cuff, and it should be right around your lower abdomen here. And if you do your transverse abdominis contraction, the pressure gauge should drop. So 4 millimeters of mercury is normal, and less than 2 is abnormal. And that's in your guidelines too, if you need to reference that. So, and I can walk around and help you with that. So you can do prone or you can do supine if you do supine and you put the cuff behind abdominis, then the gauge shouldn't move, but you still start at 70. So anytime you're doing transverse abdominis, 70. If you're using it for the cervical spine, it's 20. Right, that's a good question. It's just activation. Are you activating that muscle and holding? Okay? And it would be up to 10 seconds is what you'd be looking for.